Good afternoon, Church of God. Okay, so this afternoon we want to deal with a certain scourge that has caused serious problems in the church and in the world. And I'm happy when the president came in the morning, he also talked about it to say it is the second killer in the world currently. The second killer. Other conditions, yes, but this one is the second killer in the world because it has got a lot of branches that we are going to identify this afternoon. So before I get into my presentation, I'm asking for your consent. Why am I asking for your consent? Where I'm coming from, what I'm going to present here, it's objective information that we managed to collect from Central Zimbabwe Conference. And it's different churches. And our programming now in the church is based on some of these things that we do in the church. We collect data. We take the temperature of the church to see what is happening. I think you can agree with me to say each and every year, at the end of the year, General Conference send a calendar of events. That's so? And we take some of the programs religiously as they are. But have you ever noticed that some of the programs, they don't even apply to us? One of the programs is Adventist World Radio. In as much as it's applicable, but do we have an Adventist radio here? We don't have. Look at the sermons that come for women's ministries. End it now. The context and setting of everything else exclude our own environment. But we are forced, we are made to fit things that do not fit in our own environment. So because of such of those things, in CZC, we are doing a lot of researches in the church every time. And as we program based on information that we get as we are gathered like this. This is our care meeting lessons for 2026. And two of the lessons in this lesson book are mental health lessons that we programmed based on what we collected in CZC in the last 12 months. So one of the lessons here is depression and stewardship. How does depression affect stewardship? We've been noticing how tithes and offerings are dwindling in the church. We've seen how people are neglecting themselves, self-care and everything else, and there's a lesson for that. NGOs came and said, girl child for a long time. We've seen that in universities currently. I have a class at my college where all the students are female. Where are the men going? Take statistics in the church. We have majority of women, not men in the church. If God does not help us very soon, elders will be women. In fact, women and children, you'll be forced to get transport to go to museums, to go and see few men who will be available at that time. It's going to happen. Men are becoming so scarce. So because of that, we have a deliberate lesson here to talk about how to rear the boy child so that they remain in the church, they don't get into drugs. We have two lessons for mental health here. So, with your consent, I'm just asking, part of this presentation is going to be an assessment. We need to collect some data for our conference here, so that when we program next time, we program basing on what we know is happening in the church. Is that okay? But it's not, akuna no money kids, yeah, you can just consent. There's one form that we are going to do, that I'm going to distribute. It will take less than 2 minutes to fill it. We'll do it together. No name and whatever. It's just your age, your gender, your marital status, and that's it. So that at least we know what's happening in the church. It's the temperature of the church that we want to know. Is that okay? Thank you. So allow me to get into the issue for the day. We want to talk about depression. Kufungisisa, depression. Generally, people think that depression is a condition that affects white people or that affects people not in Africa. Until we talk about it this afternoon and until we take temperature, you may see the risk that you are in or the risk that we have in terms of depression. So, in this lesson, we're going to look into understanding what depression is and what depression is not, coping strategies, and how best can we support, especially answering the question to say, do people who believe in God get depressed? Do they get depressed? So we want to look into it, Bible examples, and look into ourselves this afternoon. So, some of the words can be kufungisisa, cannot represent depression as such, Kufunganya, Shona is not very good in terms of focusing on this issue, but anyway, we can use any of those terms, depression, kufunganya, or kufungisisa. We want to know what is depression and what it is not. So, I'm taking into some articles here which say depression is a common but a serious mood disorder that affects three things. It affects the way we think, it affects our mood, emotions, and it affects behavior. So three things affected: the behavior, the thinking process, and the mood. These three things are very important because these are the things that makes a human being. So, what is it exactly? What are the issues that we look into, or what are the telltale signs if someone is depressed? So, normally there are 2 or 3 critical issues that define depression. One of it is feelings of sadness that can hover for a very long time, or for most of the times of the day. Just being sad, just hopeless, and losing interest or pleasure in things that you used to enjoy. For example, you enjoy soccer. Unfortunately, all of a sudden, you are no longer interested. You don't want even to talk about it. You don't even want to watch soccer. When you see such things happening, question depression. It removes things that you enjoy or things that are pleasurable in your life. Okay? So, let me talk about statistics of depression, but I'll be a bit biased to women, but we'll talk also more about men. Generally in the world, depression back then, this statistic is a statistic for around 2013 to 2018. Depression affects about 19% of global population. 19% of it. This is a very big number. And the article said the rates or prevalence of depression is not different in different continents or countries. It is the same. In Canada, France, England, it is the same. But back then, they used to believe that depression affects the poor people or the poor populations, and is very low in wealthier people. That was the common belief. But however, the coming of the Ukraine-Russia war, the coming of the Gaza-Israel war, issues that are happening in Sudan, the coming of COVID-19 in 2019, we've seen a lot of nurses, healthcare workers committing suicide in Europe during COVID-19 because of depression. So we are no longer sure currently if depression is now a condition of the poor people. It could be now, or we could have the same prevalence, or it could be higher even in wealthier people. Sometimes maybe it's an issue of reporting that we are dealing with here. But however, let's try to see how depression is in terms of our gender. So statistics says women are 3 times more likely to experience depression than men. We are going to look into that, and we're going to look into that statistic. But however, just to preempt before we go further, it is true that women suffer more depression than men. Why? Generally, women are more emotional. Why? Because women, you have got an active limbic system, a system in the brain that controls emotions. So women can cry quickly, can be sad in an instant, and women can express themselves. That's point number 1. Number 2, it can be more in women because women, when they get something that disturbs them, they quickly report to hospitals, and their depression is peaked. Unlike men. Men, this gender, has a poor health-seeking behavior, unfortunately. As I'm standing here, I don't subscribe to men. I'm not a man. As I'm here, I'm not. Because men don't want to get help. So because of that, issues to do with depression in men is not quickly picked because we only identify when a man commits suicide. No matter how wealthy they are. Have you ever read this Shavane businessman who committed suicide? That's depression. But depression, we are going to focus on the symptoms. So men, they are suffering depression in silence. I think recently we've read about the Harare men who burned 2 kids in the house. We've read about the UK men who killed the wife and 2 daughters. A lot is happening. These are extreme cases of depression, which has never been solved for a long time in men. So this gender is suffering a lot, but in silence. Even in the church, we tend to ignore depression in men. So let's see, what are the issues or which aspects, which functional areas of our life is affected by depression? So let's see, I want to look into 5 functional areas. I want to look into the emotional aspect. These are not symptoms yet. Emotionally, when someone is depressed, they feel miserable, they feel empty, humiliated, and they have no pleasure in things that they used to enjoy. Haven't you ever experienced this scenario whereby but you can hardly smile? It seems as if your face is plastic cover. You can't even smile. As you try to smile. That's an extreme form of an emotional aspect of depression. Let's look into motivation. How we do things. How does depression affect a functional area called motivation? So, depression makes a person lack drive. You are not motivated to do anything. You just want to be you, seated, alone, or sleep. It makes someone lack initiative. They lack spontaneity. Even if someone greets you, it's very difficult for you to respond back in a jovial or even to smile. So because of that, they normally say because of lack of motivation, between 6 to 15% of people who are depressed, they end their lives using suicide. Let me try to explain on this aspect. In the few years in practice, I've realized that when people are heavily depressed, suicide rates are very low. They commit suicide when they are getting better. Yeah, when they're getting treatment, they get to suicide because of this aspect. Why? When they are heavily depressed, they lack motivation or even the drive to take a rope or even a gun. There's no power for such. But when they start to take medication, when they feel better, they have energy now, and they commit suicide. This is the very reason why, if you've got a relative who is taking antidepressant, don't let them control or to be in charge of their medication. Always give them, because some of them, they may commit suicide using overdose of the same medication that is helping them. That's the paradox of suicide. So as they are getting better, you get shocked as a family. Now, we're now talking stories, we're now laughing together and whatever. But all of a sudden, the person is dead. When they get better, they have now the drive and the power to commit suicide. Let's look into their behavior. They're less active and they're less productive. They want to spend the whole day seated. They just want to be a cabbage somewhere. Yeah, so the behavior is restricted. They don't want to do anything. In terms of their thinking process, people who are depressed, normally and centrally, they hold negative views about themselves, negativity about the environment around them, and negative view about their future. If I ask a simple question here to everyone, to Panoshika December, what do you think Zimbabwe will be like? Everything ahead of them is gloomy. Is that okay? Yeah. So there's negativity in thinking. They blame themselves for something that is not even connected to what they did. They're always pessimistic. Physically, and this is where the confusion comes. People who are depressed, normally, they experience some physical symptoms like headaches, dizziness spells, or general pain. Yesterday morning, we talked about severe headaches, palpitations, heaviness of shoulders, and general pain, butterflies in the stomach, abnormal discharge, and even something that is crawling under the skin. This is an extreme form of stress and depression that has never been managed. When you see it manifesting in physical symptoms, back then they usually called it conversion hysteria. But now it's now known as functional neurological disorder, especially if it presents with issues like seizure-like symptoms. It becomes functional, it's serving a certain purpose there. So these are the functional areas, 5 of them: the emotional aspect, motivation, behavior, our thinking process, and the physical body. These aspects are affected. So because of that, let's look into the symptoms. How do we see, or what exactly happens, or how does a person who is depressed, how do they present in a clinical setting? So loss of interest in activities or hobbies one once used to enjoy. And I gave that example. When you see, especially, let me talk to married couples. 2 weeks, 3 weeks, someone is not even interested. Remember, that's a clear sign that there is an element of depression in a relationship. Okay? Lost mood, low levels of energy and fatigue, failure to concentrate, you can't remember details, you can't make important decisions, sleep patterns are disturbed. You may sleep, for an adult, you may sleep for less than 6 hours, or you can sleep for more than 8 hours. In some people, depression causes them to sleep more than 8 hours. To some people, sleep less than 6 hours. When you see these things happen, remember, it could be a sign of depression. Depression also affects eating habits. For some people, they eat in their stress. In fact, I have a workmate who has, because of depression, she only has 1 meal per day. When she gets into her kitchen, she eats continuous until sunset. Only 1 meal. She doesn't stop eating. And she has gained weight. She sent me a message also I was here. She said, now I'm 120 kgs. What can I do? She's ever eating. But for some people, depression may cause loss of appetite. And they can become skinny. Depression does not give you another thing. For everyone, depression gives you one answer to come out of suffering. Depression says the only hope that you can have is to commit suicide. To get out of this emotional pain, the pain that you have, that no one around you can understand. Because when you're depressed, if you talk to people around you, if they are not aware, they may fail to understand what's going on with you. So that pain normally will drive someone to committing suicide. If you don't commit suicide, if you always find yourself having thoughts that my life is very difficult, I'm suffering, this life is useless, it's better for me to die, even without a plan, just thinking about that, remember, you are going through depression. You need to get assistance urgently. It may lead to aches and pains, headaches, cramps, or even digestive problems. I've talked about that one. So a constant feeling of sadness, of anxiety. Depression causes fear. Sometimes you are afraid of things that aren't even there. So there's anxiety. Pessimism, we talked about it. Hopelessness, we talked about it. Sometimes you may become restless. Bad temper. Depression presents with issues of temper. You become very irritable. Sometimes you may even regret to say, when you experience such things, remember, it is depression. And normally, mood swings. 1 minute you are happy, the other minute you are sad. The mood changes quickly. So, allow me, can I have someone, energetic deacons, if I can have 5 or 6 of them to come here? I want each and everyone, those who are willing, I want to give you some forms, but those forms, we'll collect them back after we've talked about them. So can I have energetic people, 5 or 6 people to assist us? Can someone come to assist me? They're depressed. Just get one form. Just get one. Just get one. Can I have others? I have many forms here. We can fire from a different angle. Just make sure. Oh, pardon. Just make sure you get one copy. Don't get many. Just get one copy. Just get one copy. Just get one copy. Just get one copy. I hope we've got my pen and it. It's okay. Just get one copy. Just get one copy. Don't write anything. I'll give you the instruction. Don't write anything. In less than 2 minutes, 3 minutes, we're supposed to be done with this assessment so that we proceed. Without a pen? Oh, okay. So remember to give me my pen after. Those who are willing, if you're not interested, don't worry. If you're not interested, don't worry. But we want you to see your own temperature. Don't even show it to someone. It's personal. We want to make this session private and confidential. Don't show your neighbor. Don't even show your husband. This is personal. 2 are 1 years, but this one is very personal. Because even salvation is very personal. You are going to see why I'm saying that. Just get 1 copy. The remaining copies, just bring them back. Okay. To those with copies already, on the space on top of the form, I want you to, if you are female, write an F. If you are male, write an M. Right? On the top space, F or M. Then write your age. Write your age. If you remember your age, just write your age. Makorenyi 32, Makorenyi 65. Right, then lastly, if you are willing, you can also specify your marital status. If you are willing, you can specify. This will help in terms of programming, because we are going to analyze this data. Then we see what exactly does the church needs. What are the needs that we need to look into as we program as a church? All right? I don't have. Okay. To those without my pen, I think if you are sitting to someone with a pen, maybe after our appends, then you can also write. We can do that one quickly. Okay, so let's get to the forms now. So, as we are answering, I don't want you to do a lot of things here. I'm asking you these questions based on the 2 weeks period, the past 14 days. If it was happening, if it was not happening, you tick or you circle a 0. If it was happening if it happened 1 day to 5 days, you'd circle 1. If it was happening 6 days to 9 days, you circle 2. If it was happening from 10 days to 14 days, or almost every day, you circle 3. I'll repeat again. So if it wasn't happening, just tick 0 or circle 0. If it happened 1 to 5 days, tick 1. If it happened 6 to 9 days, tick 2. 10 days to 14 days, tick 3. So let's go together through the process. Question number 1. In the past 14 days, have you been bothered by little interest in doing things that you used to enjoy? Losing interest. So is it not happening? If it's not happening, 0. If it happened 1 to 5 days, 1. 6 to 9 days, 2, then 10 to 14 days, 3. So I'll not repeat this. I think maybe you're now aware. So let's go to question number 2. It's private too. Number 2. Have you been feeling down, depressed, or hopeless in the past 14 days? Tick the appropriate 0, 1, 2, or 3. Question number 3. In the past 14 days, were you bothered by failing to sleep, or losing sleep during the night, or sleeping too much more than 8 hours? Whichever way. If you were sleeping for 6 to 8 hours, then that's a 0. But if less than 6 hours, now tick the appropriate one. So assess your sleeping pattern. This is an approximation. Sometimes you may not clearly remember. Question number 4. In the past 14 days, have you been experiencing fatigue or feeling tired without doing heavy work? Tick the appropriate. Question number 5. Poor appetite or overeating in the past 14 days. Assess your eating behavior. Poor appetite or overeating. Tick the appropriate one. Question number 6. In the past 14 days, have you been bothered by feeling that or experiencing that you or regretting that you have let yourself down, your family down, or yeah, you are useless, you have let yourself down and your family down? Take the appropriate. Number 7. Have you been troubled by loss of concentration in things that needs concentration, like reading, end up maybe wearing a one-line which is zokorora, or watching TV, or sustaining a conversation, or anything that needs concentration? Take the appropriate. Number 8. Have you noticed if it happened, maybe, moving or speaking faster, or moving or speaking slow? Noticing it on yourself that you are moving or speaking faster, or moving or speaking slow, or maybe other people have noticed it and confirmed it to you in the past 14 days. Tick the appropriate. Number 9. That's why I'm saying this is supposed to be private to you. Have you ever thought about ending your life, even without a plan, or just thinking that life is useless, it's better for me to die, or it's better if I hate myself and be admitted somewhere? Just that thought. Or maybe had a plan. Tick appropriately. Make sure this is private, because this is a very sensitive question. Okay, let's go to the following question. Number 1 again. We are assessing about 5 things. Okay? In the past 2 weeks, have you felt nervous, anxious, or on the edge? The scale. Question 2. Have you been bothered by not being able to stop or control worry in the past 2 weeks? Being unable to stop or control worry. Tick the appropriate. Question number 3. Have you been bothered by worrying too much about different things? Different things. Don't even specify any. Question number 4. Have you been bothered by trouble in relaxing? Tick the appropriate. Number 5. Have you been bothered by you end up seeing yourself loitering around aimlessly, but you end up moving around, up and about, in the past 14 days? How many days did that happen? Tick the appropriate one. Number 6. Have you been bothered by being irritable? In the past 14 days. Tick the most appropriate one. Number 7. Have you felt in the past 14 days that you're feeling afraid as if something bad might happen in your life? Just expecting something bad. Maybe it never happened, but you just think that maybe something bad might happen in my life in the past 14 days. Tick the appropriate one. Let's go below that table. There's another question there, written psychosis. In the past 14 days, have you ever experienced the following? Hearing someone calling your voice and you responded, but there was no one. Or hearing other commands. Or seeing other things that when you ask others around you, may not even confirm. So that's tick either a yes or a no. If it happens, a yes. If it didn't happen, it's a no. The last question. In the past 14 days, this is a very sensitive question again, especially in the church. Have you ever taken something chinodhaka kana kuputa something you want to deal with pressure in your mind? You took something psychoactive, alcoholic, and whatever in the past 14 days. Okay. So, I want you to calculate. Kanari ma 3 eda. Pese power tika pese eda ma numbers ziwayo. Waste a total wacho pazasi. So, first 9 questions, just add. Kanari win ma 3 ese, ma add. The first 9 questions are out of 27. So, put the total out of 27. In the first 9 questions. Just add your numbers. 0 is a 0, 1 is a 1, 2 is a 2, 3 is a 3. Just add those numbers. And put the total. Is that okay? Is there anyone struggling with that instruction? So add everything and put below the first 9 questions your total. Could be 10 over 27, could be 27 out of 27. It could be 0 out of 27. Right? And the next one, the next 7 questions, the same thing. Let's add, it will be out of 21. It's out of 21. Put the total. Put the total under the box. Under that box. Okay. Are we all done? Panasata filere. Wasata fila dapota wape ma pen. Wafileo. Your neighbors, can you please help them quickly? But since they already know the instructions, you can do it quickly as I interpret what these results mean. This is personal to you. Don't write your name. It's personal to you. Then after that, we are going to collect all the papers. After this. Okay. What do these results mean? What do these results mean? Okay. Okay. So, maybe you can turn the paper, turn to the back of the paper. There's something printed there. There's a scale at the back of it. The scale says, now you know the scores for two screens there. If it's 5 to 9, it's mild. If it's 10 to 14, if your score is between 10 and 14, it's moderate. If it's 15 to 19, it's moderate to severe. If it's 20 to 27, it's severe. Is that okay? Now you have seen your scores. Madam, I'll collect my papers. Yes. I don't need you to hide the papers. I'm going to collect the papers. All right. So, the first 9 questions were assessing depression. Right? So, first 9 questions called PHQ 9, Patient Health Questionnaire. 9 is for depression. So, you see the level of your depression. Mild, moderate, moderate to severe, and severe. Let's leave that one. The second section, 7 questions, is a screening for anxiety. Anxiety is out of 21, so the same is applicable. Mild, moderate, moderate to severe, and severe. Then the last 2 questions, psychosis and whatever, if you heard voices or commands and so on, it means there's something troubling you, and it has been there for a time, and is now migrating from the so-called normal depression to psychotic depression. Then the last one is substance use, because we also have substance use in the church. I'm not very much worried about your scores that are mild. I get worried when scores get to moderate, moderate to severe, and severe. Let me tell you what it means. All what it means from a clinical point, now you know your temperature. If your score is in the moderate to severe and severe, clinical practice says you're not supposed to be seated here, you're supposed to be admitted. That's what it means. Anyway, let's leave that one like that. Let's leave it. Let's leave that one, don't worry. Let's go to question number 9. Question number 9. Question number 9. Even if you've got all zeros, but if question number 9 is either 1, 2, or 3, we call it a red flag. That's a red flag. Something is happening in your life that needs to be talked about. Is that okay? Okay, so let's get more into depression. Now you know your temperature. This is the thermometer for mental health. If you get to any clinic or any hospital, they will give you this one. These are the observations for mental health. So that's the screening. Now you know your temperature. Can I have the papers? Just make sure, those who have helped, just make sure that you just are collect to Auye. We want to use these same papers for programming as a conference or as a district. I'm not going with these papers. They're going to be analyzed here so that we know the needs of the church. Okay? So let's pass those papers. Let's pass them quickly so that we can proceed. Okay, let's quickly pass those ones so that maybe we can move. We have limited time. Okay. So as papers are being collected, let's proceed with our session. So, okay. Any reflection on the activity that we have done, any reflection, whatever that you are going to say, it does not mean that it's happening to you. Just any reflection on what we have done so far. What have you learned in this session? Especially the screening one that we have done. What have you learned out of that?
I think there's some things that we think are normal, or I'm not feeling like doing anything much, and they're actually symptoms or alarms for depression. Yeah, that's what I learned.
I have learned that hospitals should design these programs, because sometimes you might, as she was citing, you might think everything is normal until you have assessed yourself. So I think these ones should be done periodically.
So if you visit the hospital, when the nurses, whatever, take their temperature, BP, and whatever, we are also advocating to have this one as a temperature assessed or observations assessed for everyone who visits a clinic, so that you know who you are. You know what? We're going to talk about the cause of depression. NCDs are one of the major causes of what we are seeing here. Just to have a diagnosis for cancer, hypertension, diabetes, and so on, causes you to think deep about your life. A life change, be it a divorce, a death in family, we're going to talk about those things. Maybe if there's someone who still have a paper, maybe you can just pass it as we proceed with our discussion. Okay. So, what does that mean? What does that mean? I'm going to share with you results from CZC. This was a women's congress or women's program that we did with the results that I'm about to show you. So, Angabudama results. We have an intentional program in CZC. Even if we've got very few people, we had only 120 women. Right? And these were the results. The ages that we had, right? So those we had a different screening instrument, what we call the SSQ. It was a very different screening instrument. But in that screening instrument, these were the ages that we had, 20, 29, 30, and whatever, 70, 79. Now, people who scored significantly on that day were 41. Out of 120. Is that okay? Okay? Let's see. Oh, sorry. These ones were the worried well. We had 53 out of 120 people with suicidal thinking and hallucinations. Let me share with you. There was one lady who came and said, I came from home, I was in trouble. I told my husband, I'm going kumsangano. I had planned kundite head on the fire ipapo. So because of that, when I'm going back, I don't want to drive. I want my friend to drive me. Thank God she's still alive. So this was some part of the breakdown that we had. So red flags, suicide and hallucinations that we had on those people. Now, in terms of age aggregation, people with hallucinations, with their age groups, we had 9. People were hearing voices and seeing things in the church on that day. People who wanted to commit suicide were 8. So people who wanted to commit suicide and were hearing voices and seeing things were 9. This is not a very small number. This is a crisis in the church. If we are going to have an opportunity to share with you the results that we get here, I think is intentional, it's going to be shared. Since there are no names, we are going to share the aggregation of these things, and you see what is happening in the church. Don't take things for granted. These are 2 reckless statements. People are going through a lot of things. Yeah. Divine. We may think it's very true until you realize that we are in a crisis. So as a church, we are too harsh on ourselves. Yes, and but people are going through a lot. Let's see what is happening. Now that we know the results, so what do we need to do? So what? Twitter say, church. That's why the results are. It has to inform our programming as a church. We don't need programs that are shipped from China to implement here. When we have our own crisis in our house, we have an elephant in the room. The house is burning. If we don't research like this intentionally, I'm telling you, the church in Africa will die when the church in Europe is thriving. Let's see. Because we know the results, what's happening? Okay? Implications to the church. I need this one. Okay. Because of what I've shown you, we agreed with a discussion with the women, right? To say, let's have more health programs with the screening. People have already said it. Let's have more resources, especially to the 40 to 49 years women. It's not a reflection of what we have here. Our results, we're going to look into them and see where do we need to put more resources in terms of mental health or even our programming. So the women said, let's have a lot of psychosocial support, income generating activities, regular mental health screening, infusion of mental health programs in church activities, and re-look into our relationships. Let me zero in or zero down on this one. As a church, quote me right. As a church, we don't preach and normalize divorce. Is that okay? But we have families who shield abuse under the guise of wanting to be in good and regular standing. We are going to have heroes, wives and husbands, after they die, I don't know, as a church, we need to rethink. In as much as we are fighting divorce, other people, but other people, as you, other people, others are crying night in, night out. We are here back in meeting. That monster, at least I find rest here. Pari kurara ari muchurch and elder oti kurara uku kusada mwari uku awana pekuzororera. We are in a real crisis. It's unfortunate. Sometimes we may not see it with the naked eye, but our God knows better how people are struggling. We need to be very intentional in the church. Let's see. So, I'm going to unpack in a few minutes the types of depression that we have. What we have screened here is major depressive disorder. Is there. Normally, we diagnose after the symptoms are there for about 14 days. We have another type of depression whereby it's not a very big depression, but the symptoms are there for a long time. It's a chronic type, but the symptoms are mild. They are different from this one. This is a mild form of depression that is chronic. Okay? Women, yes, women, yeah. Women have got a peculiar type of depression, normally called postpartum depression, prenatal depression, or perinatal depression. Women, as you get pregnant, the hormonal changes, it gets every woman into such a special type of depression. We normally call it puerperal psychosis. How does it present? All the symptoms are the same, but what does it do? Normally, women with this type of depression, either they kill their young children. This is the very reason why nurses here, they can confirm. When you have bonded with your child for a few minutes, they take the child for you to recover. That's a process of trying to fight postpartum depression. Otherwise, all the process, you can kill the child. We have many cases. I've appeared in court twice as an expert witness where two young women killed their own babies. When they appear in court, when the magistrate asks questions, they start to laugh and giggle. And the magistrate, there's something very wrong. They are sent for psychiatric evaluation, and we find this puerperal psychosis or postpartum depression. And they are given NGRI, not guilty by reason of insanity. They are never taken as criminals, but they go for rehabilitation in terms of treatment. Okay? It may take a different form, but all women, this is the very reason why when back then munhu akatizira kumurume wake wanzotizira munhu ari pa 7 months 8 months anditi vakwasha havazivi machanges on the mood of this person, ndo vakaunza nyaya yekusungira kuti vabereki vake vanogona kurumidza kuona puerperal psychosis nekurumidza, but kwamari mazuva ano masungiro is business. Moda was at the tax shop. It's unfortunate. It's functional to identify some of these things. Anyway, we have what we call seasonal affective disorder, which normally affects people, especially in polar regions. As Africans, we are affected with depression. You see white men coming back here, they come here to bask in the sun because when it's very cold, it causes depression. You can agree with me, Pamsanga, no. There are other people who are depressed because of the weather itself. This is another form of depression. What causes the depression now? What exactly causes depression? The causes are too many, but allow me to do a fly past. I want to do it quickly. I'm going to look into biological factors, psychological factors, and social factors into depression. So, the critical animal that sets depression into motion is stress. People who are stressed normally get into depression. So a lot of people who are depressed, they report stressful life events a month just before the onset of the symptoms. One day when I was in Harare, taitoronga mchato weshamwari yangu. Tichironga mchato weshamwari yangu kuma passport office kuma passport office panika interking karipo kati accident sterek because apana a controlled intersection. So takakatwa nekombi shamwari yangu ndaito driver. Ndobva tandorowera imwe Benz yayo MC yayo. Tichingomurowera tisatambuzo accident ka. He came out of his car holding a gun. And the gun was straight in our face. So before we responded, few seconds, we were rounded by a lot of CIOs with their big cars. We were now in trouble. One of the CIOs just got from his car. He came, he took the gun and the gun holder, he drove off. Others also followed him. After a few minutes, that guy, he came back and said, guys, I'm sorry. This man is not violent. But last month, he lost his mother. 2 weeks ago at his farm, 120 zakafa. He talked about 3-4 stressful events, and we understood he was under depression. So normally stressful events, they set depression into motion. Let's leave these ones. What also causes depression? Anxiety disorders, abuse of drugs, chronic conditions, having HIV, uncontrolled heart disease or uncontrolled diabetes, cancer, but just having something that transforms life quickly, something that just comes. Things like an amputation. People who are diabetic right now, currently we have a crisis in NCDs and depression. You are told that from now onwards, we are going to amputate you, are going to remove the leg. Right? And you just think now, I'm going to be wheelchair bound. It's life changing and it's traumatic. A lot of people get into depression. Just thinking that I'll be taking medication for the rest of my life because of a chronic condition. It may set someone into depression. Depression, biologically, it is caused, it can run in families. Depression, right? It means you have got a 20% chance. If one of your siblings has depression, you have a 20% chance of developing depression because it can be passed through the blood. It's genetic. If you're identical twins, the ladies, you're identical twins, if one of you gets depression, definitely the other one has got a 46% chance of developing the same condition. So it's very true that depression has got genetic factors. Okay? Now, our bodies also function using other systems that use chemicals. I'm going to talk about two systems, the hormonal system or what we call the endocrine system. We know the hormones, adrenaline and right? Cortisol, these are hormones. We also have what we call the nervous system, which uses what we call neurotransmitters. Now, if someone's got depression, studies have shown that when they were tested, they identified that depression causes low production of a neurotransmitter called serotonin and norepinephrine. These two neurotransmitters are excitatory. When they are produced, they facilitate communication to the brain and they facilitate activity. But these two neurotransmitters, they are no longer there in good quantities. And there's not very much communication. It also alters your mood. Is that okay? And because of that, let me leave this one for now. Okay, because it's there. Now, on the biochemical factors, they've also identified that there's a brain area called the limbic system that controls our emotional responses. And they've said that there could be underactivity or malfunctioning of that circuit in a lot of structures. To those who do biology, the circuit of Papez. Yeah, there's some it controls anger, it controls fear, it controls all our emotional reactions. So if there is malfunctioning or inactivity or less activity in the limbic system, you end up having depression. Okay? So, depression can also be caused by fault thinking. Let me give a very reckless example. A very reckless one. When sin came into the world, our thinking became distorted. My elder Saurombe. I once worked with the other Saurombe, so I'll use you, elder. Let's say she's not here. She's in Harare, and you are here. Normally, you communicate after day and after work. When you call her, before you come here, when you were in Harare with her, one message got into her phone to say, "My darling, how are you?" And the young guy told us, "Sure." And she said, I don't even know this person. And you called and you confirmed, "Sure, it's not known." When you come here, patema motarana se muri, mozama kufona vokata phone. Mofona vokata phone. You call again, she cuts off the phone. Then next call again, not reachable. Elder, what comes to your mind?
333 27 21.
Yeah, what comes to your mind? Tell the what comes to your mind.
That she's cheating.
Elder, I'm asking you another question. I'm seated with you in a combi. My wife calls me, ndokata phone yangu, muchitozvona. Ondi phone ndokata phone, skandaidzima. How does that affect you?
I would think it's a small house.
You think it's a small house? No. How does it affect you?
I will not be able to trust anyone. Exactly. 27, 21.
Okay. No. I want to know how it affects you, not about me. Kukata kwangu phone kuno affect I say imi. The same event. Yes, thank you. The same event, my elder. Yekuti mudzimai wenyu akata phone mukasvika pakugumbuka. The same event in the kata phone but amugoni kugumbuka nekuti ndakata phone boza tizivani. But it's the same event. So what causes depression? It is how you interpret events. Let me go deeper. What if most of us what was happening? I think you're cheating on me. My husband, pamaka phone apaya. Phone yanga iri pa silent, ichi vibrate. Ndakaisa isa pa table, ndakatofuga mandi chinamata time iyoyo. Saka because I was praying. Elder. Stop for now, elder. Stop for now. And she says, because I was praying, ndamboi kata undinamate. Saka you continuously called. Then I had to switch it off. Kundibo peza mnamatu. Have you seen that? Have you seen that generally as people, when things happen, we become negative? What if there were very important visitors that she could not pick your call?
What I think is it all depends on one, on relationship, two, and how often is that happened. Okay. If it is my wife, I tried to call her, she did not answer. Another one, then she cuts the phone. Yeah. When she has never done it in the whole life, yeah, I will not think any negative thing. I truly. But if it has happened for some time, or I heard kuti pane zvinodini zvinomboitika, ndinogona mususpect.
Sorry, those with the hands, allow me to say, allow me to, I'll come to your hands. Sorry, I'll come to your hands. Let me give you another scenario. There was a man somewhere who was angry at his family, wife and children. He says, and he said, from today on, I want to stay alone. He packed his bag. And amongst the things that he packed, akatora bucket in a poto one. A plastic bucket. ari parwizi one fateful afternoon aichera mvura murwizi ogadzika bhaketi padombo paruware paifura napo mvura ogeza aripo akaita 2-3 days aripo. On a fateful day mvura yakanaya upstream. As he was bathing haana kuziva kuti mvura rwizi rwaflooda. Ari kutogeza sipo iri kumeso bhaketi ndobva rarohwa nemvura ndobva radonha. Pari kuzama kuda kutsvaga mvura bhaketi hapana. Paakazama ndobva angobata maziso ake ndobva abata bhaketi ndokurirovera pasi. He was very angry. And he said, today I've seen that it's not my family that causes my anger. Anger is in me. Let me say something. Hakuna munhu anogumburisa munhu in life. I want you to think, anogumbuka it's you. God is in his wisdom. Dai munhu aikugumburisai. Imi mukagumbuka munhu aifana kurwadziwa nekugumbuka kwenyu. But haanzwi anything. Anonzwa chibhonzo chinogara pana pandimi. And don't know what ndonzwa ini. It's about how we interpret events of life. And God in his wisdom, if you are bitter, it kills you, not the other person. Because the other person, they have done something genuinely or whatever, or even if they want to fix you. But if you interpret it negatively, it affects you, not the other person. Inika ndikagumbuka ndinonzwa zibhonzo rinogara panapa. Ndinonzwa kuti munhu yede ndikamubata ndikamupeta ndikamubudisa neparufu. Yeah. It affects who? So what causes depression? Normally, our thinking process has become so negative. We have maladaptive attitudes that originate in childhood. Ino zangu we mnyama. Kungonzwa bere 25 years. Pasina serious relationship. Ndinenge ndakaroiwa. Ino zangu we mnyama. Andifu ndicharorwa. These are maladaptive attitudes against self. We think negatively. In fact, let me ask you a question. If Vesa you know for 25, but we give ourselves unnecessary pressure because of our negative attitudes and default thinking. Let's leave that one. Negative thing, I've talked about it. Now, let me talk about this one. Have you ever seen that other people make conclusions based on limited evidence? Kungoti matarisira agogwa wanenge vanoroya chete. Ndotobvunda panapa. Ndizo guys. Kuti anenge anondiro. We make conclusions based on limited. Tete vangovhizita ka1 mosana nemurume motosora moti tete kuuya kwavo pano chiripo charura zizarifi nemhepo. That's Africans. Everything has a cause. We make conclusions based on limited evidence. We have people who minimize positive things and magnify negative things. I have a patient who bought 100 broiler chicks. Because of Chando, 3 chicks died. Midnight, he took a phone. He called me. Zangu nasi, huku zangu zapera. That was the statement. How many died? 3. How many do you have? 97. But the statement is, huku zangu zapera. We minimize positives. If I can ask you something simple here. Simple here. Yeah, Chifamba. Ziri say. Huh? Ziri right. I want the street, Ziri say, the street version. Ziri say. Zaka dakwa. Huh? Zaka presa. Zaka sunga. Munauti paka ipa ato zika motkari. Ageza. Ato jika. We minimize positives of our lives. We don't see them. Chadakwa chi. Aba makatofika juzi nodzia. So generally, now we are training our mind to be negative always, and the depression comes because of such type of thinking. Okay? People who are depressed, they have what we call automatic thoughts. When you get depressed, thoughts that invade the mind that are negative will flood and you can't control them at any time. Kuti ufunga kuti regati mbofunga zve verse, iya funga bvangu yakoti asi murume anondijairira stereki. Yeah. Ndizo guys. Muenda kudhoka nevamwe pamuri kuti chiti dhoka twe yabva yasvika futi ada kundijaira chete murume. Vamwe vachifara una rufaro, automatic thoughts flood the mind. It causes depression. Depression is caused by irrational shoulds, oughts and must. We've got people in their thinking. Our thinking is very inflexible. Zvekuti you give yourself pressure on things that you cannot even achieve. Nozwa ma-students achiti, I'm supposed to get distinctions at all costs. All distinction by the end of the semester. When the semester ends, you can get into depression because you set standard very high. You did not give yourself an opportunity to make a mistake. To err is human. We can make mistakes, we are humans. And if you make a mistake, forgive yourself. Nyangwe ndichitoziva ndakabatwa nemukadzi wemunhu. Ndichitoziva kuti musi wa35 ndakabatwa nemukadzi wemunhu. Ndizvo hazvitochinji, it's part of my history. Nyangwe ndikachema kuti zvaitikire zvakatoitika. Ngandingotendewa pamwe kuti maimwe ndakabatwa nemukadzi wemunhu hazvichinjika pahistory. Ndakatobatwaka. I should not give myself pressure always. I should learn to be flexible and even forgive myself and ask for forgiveness from God. It may relieve us from depression. People get into a cage. Do you know other people who are not from depression, especially because of their partners? We have partners who are very good in creating what we call learned helplessness. They take locus of control from someone's life. Right? Angokuthatha zonke inzebe zakati zamsoro. Shaya dzinenge zvikezi vembanana. Munhu achibvarura munhu so ndizo kaizvo. Kusvika munhu unoti hayi handisi munhu inanditi. Kusvika ungogara kuti ina handina chakanaka chandongoita. They take locus of control until you feel that I cannot make a decision in my life. People who are like that, and we get into depression. Depression can also come because of lack of rewards, especially for women. This gender knows men. Men, listen to this one. People called women, they don't need much. What they need is just a simple comment. Even Musina chocolate. Allow me to express it. Allow me. I had a couple that came to me. So the wife was heavily depressed. They were a newly married couple, only 5 months in marriage. Then the wife was depressed. Then she came to me and said, I'm depressed. What's happening? We discussed. Let's invite your husband. The husband came. Husband, do you know that your wife is depressed? And he said, yes, I know. But I don't even know the reason. I want to know. Then I said, the wife, can you explain? Then the wife said, when you were still boyfriend and girlfriend, this man would come with chocolates. And then they pay 50 buy a chocolate. She put ndega. Yeah, I got chenamurumunga arga ufu. Ndichiro ndega chocolate. My chicken in, the wine, so on. Everything was okay. Yeah. But now we are now living together. This is what this man is doing. Not even a lollipop. And she said, Pandai tichidana ndika gadzirwa musoro. I commend her more than 10 times. Hey, this guys. Zvanzi izvo zvindikakosora mba muno. Zvanzi hey, moti zadza COVID vaya pa imi. And the husband said the following. Then we waited to listen what he's going to say. Allow me to say, I'm explaining the statement that he said. I'm quoting him verbatim. And the wife got more depressed. What am I talking about here? What's important for us to know? What's important for us to know? In life, what is called social rewards are very important. Appreciating another person. You look beautiful. Your hairstyle is okay. You are dressed nicely. It's enough, especially for the gender called women. It's enough. Plus, chocolate and so on, it's an addition. But the social rewards that are not tangible, you cannot buy that. It's free from your mouth. It's enough. Lack of such issues, it has been found to get people into depression. Depression is also caused by loss through death or loss of things that are dear to us. Loss to a business, loss through chindege. Yeah, yeah. Kwereta mari, watora mari kubasa, and so on. Robbery, or in anticipation of a loss. According to one theorist, he said, when people lose something important to them, that is so dear to them, the following will happen. The love that they had for the lost object is turned into self-hatred. Allow me to express, when I go to funerals, I'll be researching every day. I listen to people as vachichema ndoterera. Women especially, when a dear husband dies, when they are expressing their grief. Nonzi vamwe vachiti, nai baba Susan, dai ndakakuendesai kuchipatara manheru dai musina kufa. The love that they had for the husband, she's now blaming herself. Kuti, I could have done enough. I didn't do enough. That's why this person is dead. The love for the husband is turned into self-hatred, and it brings complicated grief and depression. Many studies confirm this, that imipa makabirwa phone munogona kugura kombi kubva kuchikanga mo apa pick and pay apa mapesa gona muina phone mozisearcha moshaya amusina phone monzwa mozitoka moti ino ndiri benzi ndangodi kuisa pano kachengetika ndiri so reckless. The love that you had for the lost object is turned to self-hatred. This has been confirmed. But anyway, especially death. Now, let me talk to Africans. When someone dies, if you want to help your relative asapinam depression, encourage them to cry. But usachema, she was singing so. Uloti wanazo ita say, uzoti indakatobofirwa one murume na imwe mwana nyasai kushingirira. Mafire murume wenyine angu akasiyana. Kamudandro kamaita nekangwini zvakasiyana. Allow me to express my grief during that time. Right? So what you can do as Adventists, until atiti manyaradzo. Manyaradzo now, kumbesa kuti acheme azonyarara misodzi yapera. This guys. So we can try to solve other forms of depression by such. Family social setups causes depression a lot. Levels of conflict in families, right? Especially issues of abuse in marriages and whatever has been found. Yeah. People who are single, people who are separated, people who are divorced, they display depression 3 times higher than other people who are married. So divorced, single, and separated, they have higher rates of depression than people in relationships. Okay? Do you know that as humans, we are like porcupines? As we are seated together like that, guys. But our kure, we feel very cold. We want to come back again. That's our behavior as humans. And such causes depression. If we go close to each other, we prick each other. And if we go too far, we feel very cold. So relationships sometimes, it depends on your relationship. If you are close to your partner, you can shungurza each other with a depression. Or if you are too far away from each other, for others, it's an advantage. But for others, it can be different. So this one is no one direction. We are like Nungu. Now, because of that, in relationships, a person called Murora, I've seen a lot of depression in Varora than other people. Why? Do you know when you do counseling sessions for young girls as they're getting into marriage, you give them, or you give them 2 highlights of 2 great wars that are never won on planet Earth. You tell them that kune hondo yavatete nemurora. Imwe hondo yachi yavamwene nechi nemurora. Vamwene vobva kubocha nebhageji renyemba. Genuinely, murora anona hondo iri mubhageji renyemba. Have you ever seen that? Yeah. Tete vatengerawo murora masocks ekupfeka munguva yachando. Anona hondo yakapfekwa masocks. Unfortunately. These are some of the things that causes depression. Anyway, let's leave that one. Women, just being a woman, it's a crisis for depression. Yeah, just being a woman. How many hands does this woman have? Many hands. Mesema vakubasa. But the men akundona Chelsea chiburwa. Huh? Mai vakubika, vaku aina, varikuitisa wana homework. Izo dzema zwana dzinonetsa idzi. Mai vanorana tu, vachita vanomuka zvemakuseni kudzisira mvura yekuenda kubasa. Men, I don't subscribe to you. Gender non men. Let me tell you one thing. I have a picture of myself there. I'll show you. It's not a sin kubereka mwana wenyu elder. It's not a sin. Kutotora mbereka kubereka. Oh. Elder. Do you think it's a sin? You want to assist it. Just think of this. Just think of this. She's doing a lot of work. Vanda kubereka mwana. Ndizo guys. Vanda kubika. Apa imindi ba udimanda kuti koti aisa ivireti anxiety. Let me tell you what I saw. There's a paradox here. Vakadzi munozvipinza ofuti mujeri panyaya iyi because of culture. When I came to Mutare, to Zimunya, that's my home area. I came to introduce my girlfriend, now my wife. We came there. Ini ndakapesa kugara namai paprazi. So I didn't have a problem. Taitora washe dzedu namai dishi rangu tonowacha hembe dzedu on Sunday. We come back dzoma. Togara pasina mai to aina hembe dzedu. I had no problem. Namai noti mai vachitsvaira ini ndichitotora ndove kuti chidzura mumba nditi. I had no problem namai. But on the fateful day in the morning, ndakamuka makuseni ainoti mapedu mvura inonetsa pagomo. Ndokutora mugomo undochera mvura. Mai vakatora mugomo disappear in 2 minutes. Unonyatsa pane vanhu. Pane vaenzi kudai. Unotora mugomo kuita sei? Endonobata mbudzi urayimbudzi and so on. Okay. Ndakandobva ndaita. Now ndarora nemudzimai wangu now staying in Masvingo. We had no problem. Kuti my wife is doing laundry ini ndiri kuita breakfast. We had no problem. We had no problem whatsoever. Even if you ask her today, we had no problem. On a fateful day, my mother's first visit in Masvingo, it was trouble. Juti raiva rangu rokuprepare breakfast musi wacho. Ndatoa mukitchen zvakanaka no problem. Ndava kutorowanidza mapoto. Ndakasvika kanzi uda kuti ndizo ndakakudyisa iwewe. Buda muno. I was kicked out of the kitchen. Then by my wife. Then I said to her, what difference does it have? Ukatasa video ile muchato. Wakandidyisa unachipemberera. Saka chingazondidyisa kudyisa katavatega chi.
No, you know what? Panola emotional intelligence. And she's doing it on behalf of your mother. Kuti mama anogona kuinterpreta. Mama arikuya for 2-3 days wodzoka hawomba kwavo. Would it really hurt, Kuti zvairoro woita traditional expectation ya mama? Nothing. So she was very right.
I agree with you, Elder, 130%. I agree with you. But in as much as you agree, it gives this gender a lot of pressure. She's up. So that we prepare ourselves. There's not even a problem. We have gender roles as Africans that may predispose, especially women, into depression. Okay, Mama Taura. Okay, I'm coming to you.
I think also it depends on the upbringing yatinenge takaita mudzimba medu. Iyaya yekuti vanhu vese vanenge vari free with each other. Zviya to the extent yekuti kana muroora akapinda, even kana akamboda kuzvityora, unozongoguma aona kuti environment iri munomuka haitomborina basa nekuti ndazvityora here or not. Then anongoadjustawo to that environment inenge iriyo. Talking about inini hangu handina problem. Varora vangu, vana vangu. Vakwasha vangu, vana vangu. So kana vatosvika kumba vanototi, Mums, how are you? Vakwasha. You know, varora vanoziva kuti kana vari kumba kwangu inini. Kitchen is out of bounds. This kitchen is mine. And havapindi in kitchen mangu. Unless kana ndaenda kudzimba kwavo.
Allow me in the interest of time. I've just put this in, ndangokandira njiva pakati pekatsi ndizoka. Ndangokandira kudaro. Why? I want us to think differently. Ndizo guys. Yeah. Zvinogona kuita kumba kwevamwe, hazvigoni kuitika kwevamwe handiti. But kwevamwe zviri kutouraya marriage, kwevamwe zviri kuendesera mberi. Ndizo guys. Yeah. Okay. Allow me to move in the interest of time. So women, even men have multiple roles. Now we now take work home. We don't sleep because of gadgets. And Baba is there physically but is absent. And they are also depressed because they can't even sleep. So multiple roles and so on. Right. Let me tell you. Depression does not respect a person. It doesn't respect a person. Do you know this person? Former prosecutor Wodzi. He confirmed, in fact, he was dismissed from work on medical grounds because of depression. Yes, it's there online, that's why I managed to take it. Saddam was saying, he was also a depression patient. I want you to see that depression does not respect your profession. It doesn't respect who you are. It doesn't respect if you've got money or not. This person, the Pastor Enoch Piri, he's a preacher of a Pentecostal church It doesn't respect how religious you are. Depression can affect you. This person is, this is a musician, I can't remember his name, but he's South African. So depression, understand? Okay. Yeah, so ndazama kunonga ma professions akasiyana siyana. Why? Depression does not respect anyone. We talked about these ones. Do we have case of depression in Zimbabwe? Yes, I've taken newspaper articles just for your note. Right, this was 13 December. Yeah, Anonzi Rutendo Nyahora. Atori kuma Olympics, she suffered depression. Postnatal depression that I talked about. This is one of the mothers who talked about this. I took the quotation as it was, postnatal depression in Zimbabwe. Right? GBV, gender-based violence. We used to think that men abuse women. Is that okay? And it's very true. A lot of women have been suffering gender-based violence. But of late, Shiriaka Vutaregen. Of late. Vutaregen. Men are suffering, and the paradox is, when a man go to a police station to report that I'm being abused by my wife, recently pamasvingo central police vakadeedzana zvikanziona uyai munzwe ndogara zvikanziona baba wakadai watanzaurwa nemukadzi mapurisa ndokuseka murume akangodhisa pakati I will never report again. Men are suffering, and this is the reason why a lot of men, they are also committing suicide, because they are suffering in silence. Our culture does not accept that men can also suffer. Let's leave that one. How does depression impact our life? How does it impact our life? Yeah, it affects our work, it affects health, chronic conditions, stigmas, and so on. It affects the work, it affects our relationships. I can share with you some of these presentations. Yeah. We neglect self-care when we get depressed. Long-term impact. I want to zero in on this one. Long-term impact. Depression has caused high demand of painkillers. You can agree with me. My take of painkillers because of depression is high. Because people are having physical symptoms secondary to depression, and they think it's just a normal headache, which is not very true. Right? In terms of health, higher depression rates have caused a lot of development of chronic conditions such as heart diseases, diabetes, obesity. I was reading more about diabetes because it has gone high since 2019 in Zimbabwe. There's a high correlation between high levels of depression and developing challenges in the system of transport and whatever, resistance and so on, insulin, which is caused by depression. Right? It worsens existing health issues so that a person can deteriorate and have worse mental symptoms. Depression is one of the issues when people do what we call self-medication. They try to treat themselves using drugs. Kutambo kangana namo dzake. Wote gaimboita 102 nevamwe. Imi mungafungidzira kuti yellow bond rakadai rinorowa shisha. Masangana emu street asina shisha mungazifunga imi. But this is happening because people are now taking a self-medication. People are suffering from depression. So drug abuse rates are increasing because of depression. So, allow me to talk about how depression can be managed. So I think this one is a critical issue that we need to consider. Because of stigma of mental health, a lot of people, they have symptoms of depression, but they never report to a clinic to get help. Why? One of the reasons, just knowing that I will be attended by a psychiatric nurse or a psychiatrist or going to a psychologist, people say, I'm not crazy and pengi sakandiendi koko. But people deteriorate. But the people have no problem to go to a doctor and a heart. These guys. To go to a diabetes, go to a people have no problem. But when it comes to mental health, people don't even want. I don't know why. In fact, do you know that mental health is the only condition where you are known by your condition? There are people who are diabetic here. And somebody says, hey, the sugar, I've never heard about it. Now you BP Zonziona ibenziro. Huh? To an extent that we have used the names of organizations that help people with mental health conditions to give them as their names. Zonzi MAZIMKE. And the ZIMKE organization. Zonzi Ningi SASCAM. Do you know that SASCAM is an organization? Salisbury's Association for the Mentally Handicapped. SASCAM is an organization. So because of that, we have a lot of stigma in mental health, but it's going to SASCAM kuno kumanika land. Inz wiri pamuromo. Or iwe SASCAM ivapa. SASCAM. That stigma has prevented majority of us to get treatment. So, how should we manage when someone is depressed? Normally, surround yourself with people or surround yourself with the positive relationships. Chinichekutanga, because depression comes because of a troubled mind. Make sure you offload to someone that you confide in. Look for a confidant in life. Please, Ndapota. Do you know, Varungu Vakati, a problem shared is half solved. You don't need someone kutaku pezano. You just need a shoulder to lean on. Kungondo offload. It may be enough for your depression. Right? But don't say or don't talk to someone who is like me. Kandiri pano someone different. Ndamarainum. If ukanduza nyaya yako, inondiremera ndozoti dai kukaedza ndikaudzawo vamwe. And kana zvikadaro now, depression yako inovhayawedzera anditi? Don't talk to newspapers. Look for a person that you can confide in. Unfortunately, even in the church, we have got people akanzwa nyaya youmwe munhu kwaari atova negossip rinopisa nguva iyoyo. It's unfortunate. This may increase your depression. So number one, make sure you talk to someone. Research has said, people who have got friends or relatives whom they talk to or to offload their troubles, they manage their depression better than those who keep to themselves. In fact, majority of people who commit suicide, anozonyora kari katsamba. Ndanyora tsamba iyi. Mudzimai wangu musi wa 35 August 1972 wakadyisa mumunda ndikamuregerera. Musi wa 36 akandipakura chihururu. Ndizvo kaizvo. Musana mhento kapiwani zvichiliswa muchibhuku. Hadzina kubuda nyaya mumunhu. Ndizvo kaizvo. Yeah, hadzina kubuda. Let's learn to offload zvinotiremera. Ndizvo kaizvo. Do you know even Jesus himself, when he was depressed, he looked for friends to talk to. When he went to Gethsemane to pray, he wanted an environment that can also help him. He wanted friends. So, wanted companions. So if it's mild, let's try to do what we call self-care. I want to believe tomorrow session is self-care. It has been prompted by other experiences here. How to take care of yourself, especially also even to deal with depression. So if symptoms are mild, you can look for someone to talk to, do exercise and so on. Part of self-care, we are going to do it. If it's moderate, try to look for therapy, right? But if depression is severe, there is no option. If depression is severe, by law, by Mental Health Act in Zimbabwe, you need medication. Why? Let me talk about these two things. Depression is caused by, we've talked about it, by an imbalance in chemicals in the brain. Two of those, serotonin and norepinephrine. They are now being produced in low quantities. If you get depressed for a long time, your mood is like that because these chemicals are imbalanced. But these chemicals, we want to get them back to their normal state. It's only possible quickly by taking an antidepressant. Yeah, majority of people don't want antidepressants, but a lot of people, in lengthening their recovery rate by doing other means, majority of people have committed suicide when they start to feel better. Medication will resolve that one, and people are just very much afraid. That's not very true. If your psychologists and psychiatrists are dealing with you clearly, you can take it for very few months, then you are off, depending on how much you have been depressed or for how long. Why? Let me specify this one. If you have been depressed for a very long time, chemicals also take time to get back to their level. So normal practice say, if you are initiated on an antidepressant, you're supposed to take that antidepressant for the next coming 6 to 9 months without relapse, without symptoms. And when you continuously go for review and assessments, they can taper down your medication until you are weaned off. You'll be reporting what's happening to you until you agree to say, no, for now, let's stop medication. Right? Is that okay? So medication is never bad for you, especially if it's very severe. How severe? If you're having hallucinations and delusions, if you are now having red flags like suicide, it's very critical to get medication for you to recover better. But now, we have a whole gamut of talk therapies that can help. I want to remind you, medication does not treat depression. It only deals with symptoms. But the real issue that it gets you into depression, it needs to be discussed between you and your therapist. If it's not discussed, then we haven't done anything. So, the best treatment for depression is psychotherapy. There are many therapy approaches that are there, cognitive behavioral therapy, psychodynamic, and so on. There are many, depending on the therapist that you have approached. Maybe your question is, where do we find these therapists? Because there are very few. Yeah. But of late, I think the number is increasing. Here in Mtara, I know a lot of therapists now with their different rooms here. But if you go to a mental health hospital, therapy is for free. It's there and it's for free. Our psychiatric nurses are trained for this. Our psychologists, they're trained for this. Our counselors trained for this. So, don't waste time. Treatment and help is available. My last part, I want to shed more light into relationship between depression and religion. Because we have people who say, because I'm a Christian, I believe in God, I cannot be depressed. We deny existence of depression. But I want to remind you that in as much as we are strong believers, we are still in this world. We are surrounded by trouble. We are doing everything in the context of the great controversy. Remember, Ellen White says, I saw that God will never save slaves. I can't remember the book. Go and look for that book. I can't remember the book in that quotation. Slaves are not going to be saved. Because she says, slaves' minds have been conquered by someone. They don't think for themselves. And I read a book, Curtain Personality, Mind, Curtain Personality. It casts something like this to say, if the mind is troubled and conquered by the devil, because it's the center of great controversy, no one will be saved unless if you are treated and get back to your real thinking and accept salvation. You are just like a slave who may never be saved. Let's just track few people in the Bible who were once depressed. I'll start with Job. Job, Job chapter 30, verse 16 to 20. He says, depression haunts my days. At night my bones are filled with pain, which gnaws at me relentlessly. With a strong hand, God grabs my shirt. With a strong hand, he grips me by the collar of my coat. He has thrown me into the mud. Is indeed the thinking of someone who is depressed. I cry to you, O God, but you don't answer. This is my experience in depression. I'm feeling as if everyone around me don't understand me. They don't want to help me. Sometimes they are helping me, but I'm not seeing things in the correct perspective because I'm depressed. Is it true that God grabbed Job by the collar? No, it was the devil who was doing all this. God was on his side, but because he was depressed, he never saw things clearly. But when you are depressed, we have almost the same experience. The Tishbite. Elijah, 1 Kings chapter 19, verse 4. He cries out, I've had enough, Lord. Take my life. This is suicide. For I am no better than my ancestors who have already died. After I did something great, killing 450 prophets. Wamanyamberi kwengoro. Achimaine makumbake. Chidzimai chimwe bedzi chinonzi Jezebel. Choti mangwana iwe ndo udila newe. Zvikanzi Mwari zviri nane ndife. Apachina kana nyaya Mwari. Kufa kwangu kutori nani. He was heavily depressed, but he was a hero of faith. The woman with an issue of blood. Her chronic condition, she suffered for 12 years. had a chronic medical condition leading to social isolation and financial ruin. Her journey to seek healing reflects deep desperation and despair. When Ellen White comments about this in the book Desire of Ages, unoti Jesu pakati ndiana andibata, just she was trembling. This guys, she was heavily depressed and afraid. But what caused that? A chronic condition can cause that. 1 to 6 years, 10 years, neck cancer. This guys, 5 years, amputated. Such conditions can get you into depression. We always castigate Job's wife. Yeah. I have a different angle of seeing Job's wife's issue. Why? And this is marani pedu pazimunya pakamboita outbreak ye Mezi 1992. Mezi child. Mezi zozoweti zikakubata zanziri serious. Muningi na wangu waitaba bora ku family yanga ine Mezi ndo kuyana zokumba. Muningi na wangu wakaine Mezi zainge fortunate yayo one zihombe apa imwe paruoko isupata kabatira zakaita sekuti une chicken pox. Now mukadzi wacho tasai Job mamira akaita. Mukadzi uyu she was faced immense grief after losing her children and wealth. And so on. She has multiple losses. Amid such losses, now murume vaita maronda. Mezi zinonwa singaita. And za Job za mezi kanchi. Munhu ane mezi hadi kugeza. Bozo kada kugeza zvova taiva anzi wapedza kugeza unzi salt. When mwiri wese wakaita red wasurwa mezi dziya waisa salt. It was never a good experience. Zvichinhuhwa kudaro mukadzi waJob ndiye ari kuchinja murume wake every day. It's not a very good experience. To those people who are nursing people who are bedridden with the dementia and so on, you get into this experience, you get depressed. So mukadzi, it's better kuti murume afe. This was a reaction of profound impact, a loss. Yanga kuratidza kuti she was very depressed and emotional. Naomi anoti kudi. So Ruth anoti kudi. Anoti kudi Ruth. Okay. Now achidzoka anoti kudi. Anoti ndichinje zangu ndite yani? Mara. I'm bitter. I lost everything. When she came, people who are depressed wants to be alone. They don't want other people to be near them. Saka mama anoti kudi. Warora. Warumenyu wakafa. Yemwe ndikaona murume nasi akuna chinoitika. Endai kumba kuindende ndega. Mumwe munyoraiti. Perchance she wanted to commit suicide along the way. Rangarira ikumba kwa ari kuenda ku Bethlehem. Vanga watengesa munda. Anga sina pekugara mai yavo. Havana kana kurima. And this murora akamubetsera mukadzi uyu, she could have committed suicide along the way. Depression is real. Hana kusika muprista ati iwe unenge wadhakwa handiti? Yeah, you can do certain things. Last year I was a meeting. What has happened with her? Depression can take a toll in your life. Yes. Does Jesus care when you are depressed? Does Jesus care? So Psalms chapter 56 verse 8. I like this one. Yes, it says, you keep track of all my sorrows. You have collected all my tears into your bottle. You have recorded each one in your book. You have kept track of my every toss and turn through the sleepless nights. Insomnia is part of depression. Now, David thought, Mwari imi munochengeta misodzi yangu. Zvanzi, when we cry, God weeps along with men. Mwari ana nhoroondo yekuti anokusiya unopinda musituation iona ari panze oti zvakuwana. In the lion's den, Christ was there. In the fire, he was ever there. Wakomana kasvika moto wakutotonhorera kusvika mambo ati taisa vanhu vatatu which phone ndiani. Even in our depression, Christ gets with us and he weeps along with us. We are never alone. We have an ever-caring God. That should give us comfort. I know it's a struggle to think about there's someone who cares about me when you are depressed. But the reality is, God weeps along with men. One day when we get to heaven, we are going to see this is part of your experience that I've collected. And the Revelation says, he will wipe away every tear. kana taponeswa ndizo guys. Ndakavunza kuti handkerchief yaMwari yakakura sei kupukuta vanhu vese vamisodzi post tesinongochema nditi munyandofara unoti God does not literally wipe tears. No. What does he do? Anobvisa chitubu chezvinorwadza paupenyu. We will never remember any hardships. And we will never remember our troubles on earth. We will be happy ever when we get saved. Because we have our God. In the interest of time, godly women and other men in the Bible, what they did when they were depressed. Hannah prayed. Job's wife expressed her grief. Don't keep silent. If it means crying, cry. If it means screaming, just go out now, get into the toilet, scream, express your emotions. That can resolve your depression better. Naomi returned home. Do you know sometimes depression is caused by failure to have social support? Yeah. You are alone. No one wants to help you. You have got fees, issues of your children, whatever, and no one wants to help you. Return home. Return home. You can get a better social support structure. Women with the issue of blood, what did she do? She sought healing. Going to the clinic, looking for a psychologist or a psychiatrist is not a sign of weakness. It's a sign of strength. Because you are a steward of your own health and of your own mental health. So going to look for help, that's a strength. It's never a weakness. And remember, in mental health, we use the hand. Information that we have, that we've shared here, supposed to be very good to help us. If it doesn't help, let's look for strategies to reduce stress and strengthen social support. If I'm depressed because I don't have fees, let's help each other, right? If I don't have food in my house, let someone give me food. Let's address our needs. This is Christ's method. Let's address the needs of a person. If it doesn't work, let's promote functioning in daily activities. This is our next presentation tomorrow of self-care, improving functioning. Then if it fails, let's look for psychotherapy. If it fails, let's go for pharmacotherapy. Let's get medication. Remember, medication is the last resort. It's not the first. Let's get information. Let's know what's happening. And let's try to address the needs. Let's promote daily function through our new start. Let's be watchful about our diets, our exercise, and so on. It's a good buffer for depression. Then let's go for psychotherapy if it persists. Then, if it doesn't, let's accept medical attention that can help us. Lastly, in depression, God will wipe away all tears from their eyes, and there shall be no more death, no sorrow, no crying, neither shall there be any more pain, for the former things are past. So there is hope in depression. Let me have some few hands for responses. Let me see hands that wants to say something. So I'll start with those who haven't said anything. Musati. Okay. I'll come back to you.
Okay, so I have two issues. The first one, you said when somebody says, really say, and then people say, lolo, pakaipa, tight. There are some people who go the extreme route. They say, fabulous, marvelous, walking on air, I'm blessed, ever nice. How is that? How is that? Are we permitted to do that, or is it too much? That's the first part of my question.
Thank you. Thank you for raising such a question. I overlooked that one. Some people may do that as a maladaptive coping mechanism. They are masking a reality. They will just want to go out of reality, but it's not very true. That can be a bit dangerous. But sometimes it's good because you want to remain positive. But we can be positive to a certain level, not beyond that. When it becomes a maladaptive coping behavior, then it becomes dangerous.
Then my second one, let me stand for this one. This is for the men, all the men in the house. Say amen. Yeah, all right. So you were talking about the Murora syndrome. I think as Adventist men, you can take it upon yourself to protect your wife from your relatives. Sometimes they don't even mean badly. It's the way that you are at your house, which is not how she was brought up. Protect your wife. She's not the donkey of the house. Protect her from the work. Protect her from standing too much, from making tea for everyone and food until she is so tired she doesn't know what to do. Amen.
Yeah, this is a critical point, to be very honest. It's a critical point. But also, I want you to know this. I want you to know this as women. I want you to know this as women. Men, this is a given. Let's help our spouses. Listen, guys. Helping them. One day in the Kaberika Mwanamko, I wasn't married by then. It was a crisis of the year 2009. Pangoita Q, my two moms gazuti chi. Pakaita Q sugar. Pa breastside okay. My ground to Bami, I've connected, let me run. Why want to come on a church? Get my good chin paying man and Sandy Bereka, Imimania Q sugar, was Musicano, Dover my Q. Dover the Bereka on my ground, Dover and my shops. The chicken that will meet up a queue. My young with Shukuru get a semi. Vaka we are Mashure Kwango. Doga Passage Bank, Dog to Beggars and Quashan Duoni. Dogo for Andoko guns. Ah, they've got Macaberika Mudori. Mana, Makapanam Quashami. Women, I'm not very sure. Women, I want you to note this. I want you to note this. When every man gets married, men, this is also important for you. When you get married, you have got 2 women. A minimum of 2 women. Your mother becomes your second wife. This is reality. Now, my Jaira good. Nice Samson. Isaka 20. But this time, because of our social structure, go via there. Panogona quit unhealthy competition. You now have 2 women in your life. Other women can be added if you've got sisters. This is a paradox in life. We may deny this, but this is reality. It needs to be managed, well, like what she said. It needs to be managed. Being a man, it's not the same as being a male.
Thank you very much for the talk. I think I want to be a little bit radical. I think we should stop asking the question, how are you? A lot of the people who can't, how are you, there are 2 possibilities. Either mgoboze arikuchaga information achida usonoza wanu sawamuza, or it's someone who's genuinely asking. But because you'll never know, I think whenever you're asked the question, how are you, you must be careful to respond and how you respond, because how you're feeling is not necessarily how you should respond. But we become very literal as people. Hi, how are you? I might answer you and tell you how I actually am. And you might not be in a position to help. Or you might be in a position to just seek information. So just tell trusted professionals.
So I have 5 minutes to wind up the hobbies that we have. So your comment, let it be short and precise.
Okay. Ini ndoda kutaura kuti pane foni yakamborasika ikauya nekwandiri. Saka inini mai respond andigoni kutaurira munhu rafu ndakadaira zvakanaka. Asi zvakaitika ndezvoti murume uyu paakafona, mufunga akazofona rwepiri, mukadzi wacho anga ari padhuze akati, uri kumbotaura nani? Indakazvinzwa manje ndikati apa paita dambudziko. Ndikati mwanangu unenge wakanganisa nhamba yekufona. Saka ndakazofona bheki. Pandakafona bheki mukadzi wacho ati unza kunofona yacho da kunzwa kuti ndiani wari kutaura naye. Saka ndakazonyatsoda wakazonzizwa ndimani ndikataura ndikati ndini ningi. And I'm sorry, ndikati I'm sorry notice takura maybe pamwe hangu ini ndindatadza kurisponda saka aiwa gogo muri right. Hamtu mukona dai ndakadaira rafu ipapo kazvaizoitika ndizvo vanhu vaitoda kutorwa iwo noti mabvunzira akaita mukadzi unza kuno mwana ndidaire nawe inini mamai wavo mavari kuti mama wacho ndimama wapi.
So chimwe chinhu chinonzi effective communication chinogona kusolve depression zvakanyanya. Ndizvo guys. We were programming a certain program in healthcare workers after COVID. We realized that healthcare workers developed a new language during COVID. Healthcare workers used to speak English, Shona, and Ndebele, and whatever other languages. But they added a new language. They added RAF during COVID. And yeah, now, chinonzi RAF chi. Sometimes it's your interpretation of what has been said. Umataura zviri gentle, but kuno umwe munhu iRAF. Zvinogona kudaro. But the best line there kuti, as we speak, let's respond effectively. Let's put our issues across well. Kandi ndichiona kuti ndichiri emotional. Ndizvo guys. Ngaimbomira kuvhiyiwa. Ndizvo guys. Ngandimbotiza ndibude ndozoona kuti ngatichitaura nyaya ndakunzwa zviri nani. Ndizvo guys. Chitombotomwa mvura usataura. Because dzimwe nguva munogona kuti haivhiyiwi, haigochwi mukapisa imba.
Nanda kubvunza kuti is it normal for a child ane 7 years kuthreatena kuda kuzviuraya? And also avati kuri hava kuma 11, 12, 13. There are many cases ari kuitika evana vari kuita sei vari kuzviuraya. Could it be kuti vari depressed? And also how can we help mwana ane 7 years? How can we help mwana ane 12, 13 years chidaro?
Alright, indine mubvunzo ne question ne contribution ne contribution sorry. Ndichatanga ne contribution ndozopesera nemubvunzo. Ndikuda kuti mazuva ano ndaona sokuti zvakakosha kuti tisanyanye kujoka kana kutora zvinhu lightly. Mukungotarisa kwangu ndiri kuona kuti zvimwe zvinhu munhu anogona kungotaura casually but iye ari kutorevesa. Saka zvakakosha kutraya kupay attention to detail. Kana munhu ari kutaura paunogona kungoti tachitongotaura ndofanira kuti aiwa chichi, kana ubva watongodzoserawo kamwe kana kujoka nezvinhu zvemunhu iwe wakurisa usina kuroorwa iwe, kana kuti wakurisa hauna kuroora chichi. Ndona sekuti zvakakosha kuva kuchi-exercise kuva too sensitive. Magarisa hamuna mwana imimi, chii chamuri kumboita muri kudya sadza remahara what. Zvakakosha kuva sensitive kuvanhu. Hauzivi wauri kutaura naye, chero maybe mukombi kana kuti ndekupi. Zvakakosha kusada kujoka. Vamwe vanozviita vachida kuti vasekese vanhu. Vamwe vanozviita vachiti no, ndokutamba kwani, ndokutamba kwedu, but of late ndiri kuona sokuti zvakakosha kungotora zvinhu zviri serious uye zvekare kuva sensitive. And then my question is it possible here kuti munhu anogona kuva depressed otadza kuziva kuti ndiri depressed?
So I'll start with this question. It's very true. Okay. It's very true. You can be depressed without knowing that you are depressed. If you don't know what we've been talking about, the symptoms and so on. Many people think that vakaroiwa, vane munyama or whatever. And they've been going kumapostoli and they are thriving ikoko. Vachinzi uyai kuno nemazai mangwana uyai nehuku ukachinenge chekwa chigune chete vatorwa ropa yobigirwa muri yemprofit. And you make many losses because of depression without knowing that I am depressed. That's why I'm saying information is power. It's very important. So knowing is very important. I'm answering your question. Now, I think I've only dealt with depression for adults. Children's depression, I've got another presentation for children alone. It's different. Children, depression, a young toddler kanogona kuva depressed. How? Pamba pakaita serious changes. Paita funeral. Vanhu vari kungoimba. Hakana kuzvijaira. Mwana can be depressed. Kuchema kusingaperi kuya. That's depression. Mwana pouya muenzi, mumubvisa mubedroom rake maajaira. A child can be depressed. So we have now, children when they are depressed, they act out. They don't usually show symptoms as adults. That's why I didn't want to mix these two. So it's very true, and they can be helped. There are treatments for children.
Thank you, sir. I'll be very short. Maybe we're going to let's live a varied life. Maybe there might be 5 quadrants. Financial life, intellectual, social, physical, spiritual. If these were balanced, it is really that is just no crumbler. But yeah, depression man, they put everything is in one bucket. Could churches are bondo candidatica? Our social life could minus church. I've got siblings. I've got more workmates. Because we want to go to church, but my siblings are good life here. Tine nguwa kunotamba volleyball nechess. Tine nguwa kuwatcha movies. Yes, and kunamata akubasa mari akutorina anditika, but that doesn't stop me from having to go for a walk nemukadzi wangu kana kuenda kuboda kufamba netsoka chako chako early Sunday morning. That will help. Walking tatadza kuenda kunofamba tatadza shaya mari, but kune nguwa evening devotion semuri. Kune Wednesday, day of prayer and fasting. So life ingaive iri balanced. Azvingazombo crumble zvese at the same time. Thank you.
Let's learn to accept things as they are. Chapinza mwana depression is failure to accept the reality of their lives. They want to live mupenyu wani wevamwe. Zviri right kuwa ambitious. Ndizo guys. But kune zvimwe zvacho zvinopusha vanhu kuti vazoita chii? Depression. Zonzi baba wako ningi vanovhurira mukadzi wavo dhoo pamotikari. Inambondivhurira dhoo. Ndio kuzoti dhoo rakafa rotovhurika nepanze chete. Papa sina kana rudo paya. But makatozvipa pressure kwani? Kwenyu mukaita depression.
Thank you. I wanted to say, Kuti, in terms of depression, maybe culture is not our best friend. Because we might learn of depression, even with these lectures and studies on depression, I think taiti ndezvevarungu most of the time, kuti munhu ari depressed saka zvine basa akayemedzwa urwa haana kusimba. So even in families and within our culture, kuti uti munhu aita inonzi postpartum depression and akadzipa mwana, you'd think ane zvinhu zvekumusha kwani, ane zvinhu zvekumusha kwavo, munhu anogona kutorambirwa postpartum depression because adzipa mwana, and a whole lot of other things. Kunzi ndofunga ane mhepo kana kuti akarohwa nezvishiri, or even munhu azvisungirira zvinonzi imhepo dzekumusha kwani, dzekumusha kwavo, musagowe nhumbi dzake, musadini. And yet someone has been suffering from depression, and our culture interprets it differently such that we are not able to embrace it and also help and support people that are going through such.
Thank you so much. Let me add something else. It's not even sinful to say no. As this in fashion, kunzi ndimi head elder, nominating committee agara yati ndimi head elder, moti ndizo zomunhu wamwari. Umodzoka tumana imwe role zonzi ndima nzikorita this year, hongu munhu wamwari. Modzoka zonzi ndimi stewardship director. We are not angels, we are human beings. And out rambai basa. But let's accept things that we can manage. Learn to say no. On certain things, you have to play bang zadi zawandisa. Failure to say no, especially in church circles, has killed a lot of people with depression. Because basarani and vachuya so vachu vamangiti naimkoma mukaramba basara mwari. Umotumwa mukaramba basara mwari. Unopi wamabasa 10 as if you are the only person. Christ died for the church. I don't need to die for the church. Learn to say no. Asante kuti rambai basa.
Ndaida ngoti kana uri mukadzi wangu unenge weida kuudzani depression yako usingaudzeni murume wako. Wasn't all right. All right. Okay. Iyo nana do pizza. Bozi. Husband is the office ka. It's not an office ya ndinopinda ndichibuda. So kana watondendera kwa husband yako, it means ndo kwana pa criteria yo. So kana wakushia nemwe munhu, especially ina hangu andingazotofara inotozoita depression manje. Kutozonoda kushia nemwe munhu. Then also maybe kana tadaro yeope andingatoda ndeyekuti inini ndinotaura kuti ndisaenda mu depression. Kumukadzi wangu kutaura kunomuisa mu depression. inini kutotaura kuti ndibude mudepression handizoti ndiri kugona kutsanangura iyo depression yacho, but ndechitotaura nemukadzi wangu because I believe I have to share with my wife. Maybe ndiri kutanga, maybe I'm wrong, I will need to be cancelled maybe, but iye manje to her I'm not saying ndozvinoitika kutotaura kwangu maybe notoona kuti ashasha ndikutoipinza mudepression. Alright, saka pakadaro panoitwa sei. Then what also I wanted to say is panyaya yekutakura vana iyi hazvina kushata, but I think inoda kungozivawo murume wako kuti uyu boza hazvizvekuzva ndafarira pfungwa yemataura kuti usakombeya nguo nedzatarubva kuti yo zvawanzwa muchechi kuti hanzi vana boza atorimo kamukudzimai wangu izvezvizvo ozoonzwa kuti vamwe vanototakura vanhu vaitoonzwa namukoma wako. So to save you, ukavaida kuti murume wako ararame upenyu hwakareba muzive urega kuteedzera zvevamwe.
All right. I want to respond to his issue. Yati iye nemukadzi wake vakasiyana personality. Iye unotaura uyu haatauri and so on. This is very true. Marriage counseling yatoita mapastors edu iri right, but dzimwe nguva haigoni kuzosvika kupika zvinhu izvi. We are now offering a service to those who are not yet married, where we assess compatibility. I'm telling you, why? A lot of people vari kugara marriage dzekushingirira, but they are not compatible. Compatible, umwe ari kutaurisa umwe kutaura handikudi, wanzi kutaura hanzi matsengero ako unoita sekuti uri chigayo chiri kutsenga. Ndizvo guys. People, compatibility is something that is very small but very critical. So sometimes if vamukanasikana mukauya, we do compatibility tests and counsel you. We can even advise you kuti in terms of birth order kuti uriwe chingani mumhuri menyu zvinogona kukanganisa marriage. Yeah, ezogona kupinda munhu mudepression. First born, they are deputy parents. They have grip on everything. First born ikava mudzimai panomanywa pamusha.
My first born ndiwo ari kutaura. All right. Vazvitaura, but I just wanted to say, part of his presentation he said depression knows no gender. It also knows no age. So I'm going to give this example. My daughter is 5. Panamadiza akatanga nochikoro, then she would come back. Mama, there are some children who said some bad things at school. What did they say? They said you have a big forehead. So she was not 5 by then. So I said, can you look at me? She looked at, do you realize that your mom also has a big forehead? And she says yes. Now, if my sister was saying, where did Kupa get it? I look like this because I'm beautiful like mommy. So I told her, next time they tell you have a big forehead, you tell them you look like your mommy, and your mommy is beautiful. So I am beautiful and I'm fearfully and wonderfully made. A lot of young children, eventually going to my youth, they're struggling with identity crisis. They don't know who they are. And it's our job as parents to give them that assurance, that affirmation, that they are beautiful, they are fearfully and wonderfully made. Saka depression inotanga kubata vari vadiki. And we have become so busy as parents, especially vanamai vanoenda kumabasa seni. When we come home, let's create time. Let's intentionally make time for our children. Because at school now, be intentional about finding out how was your day at school? What happened at school? What did you learn at school? You are trying to establish a relationship where they can freely talk to you about anything from a tender age, so that if there are issues that need you to address, you can give them assurance. So now my daughter knows she's beautiful. She cannot be bullied or be led into depression because of her forehead. Because mama has a forehead, she's beautiful. Then secondly, I wanted to say about culture, which is disadvantaging most women. Let's make it our personal responsibility to change the narrative. Because tomorrow ndini nchange ndiri vamwene mukadzi wakuda. But ndichange nakuomesera futi muroora uya, but ndadzidza. Saka isusu kana tadzidza, wherever possible, let's try and do the best we can to change the narrative, so that we can make life easier for our future son-in-laws and our future daughter-in-laws. Then I wanted to say, when it comes to religion, I also don't think the church is somehow a safe space for people to open up. If you are someone who is very interactive and who talks to the youth a lot, the youth have a lot to say, but they don't know who to talk to about it. Because at home, hakuna a conducive environment yekuti va discuss my issues with my parents avo. You realize kuti a father would want to be involved in the son's life. But throughout kukura kwake akubva pathfinder into, they did not have that kind of a relationship. So it becomes very difficult for you to start discussing issues nemunhu akura kudaro imanga musinga establish a relationship. So parents, go home and create a conducive environment for your children to open up to you. Then about my spouses, my twin sister was just saying, what if you are the cause of the desperation? How do I talk to you about the issue that you are, do I consider? So obviously I need to maybe talk to somebody else who is not you. Because I'm also realize that you are doing something that's depressing me.
So if your spouse, like what you're saying, my young brother, I think allow, in as much as you are a couple, she's still an individual. She's still an individual. She has her own crisis. This is the very reason why. Unless kana mukanzi maita tsaona mafira po mese, anizwa rake rekufa unira kurekufa. Munotoigwa makuwa akadi akasiyana. Umonogona kuponiswa mwachirashwa. We are still individuals. So in terms of these issues, looking into what is happening in the world, allow yourself to be an individual and express your issues the way you want. Allow her to do the same. Okay.
But I was once a youth. Sorry, I was once a youth. Again, telling my youth was concerned about. I would appreciate if she shares with a female. But I have discovered with the males, they take advantage. While at least the women they are not yet aware, they are already being taken advantage. Maybe, all right. Why am I saying so? Why am I saying so? Kune vazhinji hatizive my generation apa, but kune vazhinji vakatozosvika pakuroorwa nevanhu vavakangoendera vachindoshare zvandotoziva. So inini mukanzwa nchiti handidi kuite best friend, haizinya kuti ndine insecurity. I'm speaking from experience. Shoma iyoyo yekuti they will later take advantage of you. Wangu ndochita chivambo wauri kuona ari kudai. Then at the end of the day, you are gone. I
agree with you, but I want you to think differently. I agree with you. I think it's better for you as a couple to agree with you. Let's look for professional help. Even professionally, we are in a sinful world. My elder, you are the last person.
Yeah. Zvinogona kuitika kuti ndiri maybe cause yacho, but I still remember vatete vangu maishepati murume wavo aitombopota achivarova, but I remember one time the next day makuseni patati akumwa tea vaka nenzwi rakanyorovera. I still remember that even a kitchen yacho ndiri kuteiona so. Vakati baba shepherd asine zuro makandirovera chicha chaizvo. So but I can't remember the response the husband gave, but I think that approach she had, it was sobering in a way uti kana anga akashatirwa the previous night. I think at that moment he had sobered up and so, and I want to believe with the tete vangu vanga vakachenjera, vana vanga vaendawo zvavo kuchikoro, but vanga vakachenjera tete vangu my shepherd. Saka to the women here, ngwaraiwo satete my shepherd.
Thank you. So allow me. So elder, ndipe 2 minutes for these two hands. Only 2 minutes for these two hands, then Dova Tafar.
Okay, ndachidonyanya kutaura pama-youth nenyaya yema-relationships kuti chiri kunyanya kukonzeresa especially nowadays ma-relationship anongotanga nhasi mangwana yato marriage vanhu havana kudzidzana and panoitika especially panotanga relationship kazhinji you pretend pane zvimwe zvinhu zvaunotopretend kana zvamunonyeperana zvinozocosta mamumarriage saka sema-youth it's best kubuda pachena kana especially makunyatsoona kuti makudecida kupinda mumba mese because zvine ma-long term effects amusingagoni uzorivhesa because matomba ndo zviri kuita mamarriages akawanda aputsike due to nyaya dzekupretenderana nechi because pretense you can't do it for a very long time. Then paissue yemarriage yekuti kana marorana vana vakadzi nevarume kana mai vauya kana chii zveya zveya zviri kunetsa izvi imwe nyaya iripo ndeyekuti isusuwo vakadzi chandaivaona kuti murume wako anokuda anokuitira zvinhu ngatingoacceptei kuti it's nature sometimes especially muAfrican culture yedu kuti ana mai kana vauya ndiri a bit possessive nemwana wangu ndinofila kunge mwana wangu ari kutekwa advantage handisi kuti chinhu chakanaka kana kuti ndiri kuti warume wasaitire vanawo zvinhu but sometimes it's best we do zvinhu zvakanakirana izvozvo tiri tega to avoid ma-unnecessary dramas asiwo sevana mai ngatiacceptei kuti when our children are married ngativapewo space yavo toziya kuti mwana wangu ane mukadzi wakewo ari kutsva dumbu nemusana because we can't compare rudo rwamai nerudo rwemukadzi. Those two loves can never be compared because handigoni kuva mai mukadzi wemwana wangu inini ende handigoni futi kuti ndisawe mai vake asi handigoni kuti ndimise pakati kuti akompee kuti anoda mukadzi wake here kupinda inini because hazvikompeki saka ngatidzidzei ngoti kana vana vedu varora toziya kuti anewo mukadzi wake ngavaone nguva yavo kwete kuti maproblems atakawanawo isusu tode kuti varorawo auya ndichamuonesawo moto azive kuti mba yakamira sei.
Thank you. Let me take my last hand, then we pray.
Elder, my question to you is, have you ever had situations where the clinical approach failed and the spiritual approach prevailed? And how do you know that, okay, this is spiritual and it's not clinical anymore? Because we can't negate the fact that the devil takes opportunity and sometimes there's a spirit of depression. So how do we know where to draw the line? How do we know, how do you know? Because I guess you probably have testimonies on that. When to stop saying, okay, this person, this is clinical?
My answer may not be very satisfactory, but what I still believe is there is no condition or disease without a demonic influence behind it. Because when God created, everything was good. Depression, we are trying what we are trying, but Satan is behind what is happening. Because when God created, there was no depression. When God created, there was no anxiety. When God created, there was no cancer. So, we are firing from different angles. Nowadays, we are using the psychosocial, spiritual approach. Spiritual aspect is now infused. We have now spiritual aspects and theories that are coming up now to deal with depression and other mental health issues from a spiritual point. Normally, I've met clients who say, we don't deny that, but let's use both. Rather than saying, you know what, mental health is very easy because munhu anorwarira in the context of their culture. And normally whatever. Zvimwe zvacho as a practitioner I have no control. And I made a but please make sure mushonga wemuri kutora. Ipapo atigoni kuti musaita zvekwenyu zvamoda kuita. Itai zvekwedu because kazhinji paita a great clash. So we need to agree on such things. So my last end is you, Elder.
All right. Ndinongo wedzera chekutanga ndoda kuti pama muchipresent apa ndinoona kuti mapresentations enyu pamwe pacho mune muchijamba muchiti timhanye tisvike somewhere. How much time do you require to do a full presentation which has no gaps? because kazhinji zvinozopera vanhu vachiri kuda kunzwa kuti zvinatsopere kupera chaiko chaiko. Then my contribution to zvemacouples izvi, I think statement rekuti you are my best friend chichi ndere pamuchato reya. You are my best friend chichi what my best friend. I think azviite kuti todanana nhasi wobva watochidya kuti best friend yangu. And you should allow murume wako to have a friend. Varume vazhinji achinga vari kutambudzika nenyaya yekutraya kuti munhu asiri best friend yako your best friend. Allow your spouse to have a life outside you somehow. Like my best friends and so on. Zvafana kompita na mai wangu. I mean, mai wangu akanitakura for 9 months mudumbu. Come on. Hakuna mwe mnakwanisa kuita zvafana izvozvo. And for you to fight for a bond which is closer than that, to me I think it's madness. It's depressing. So I think my point is let's not have my eggs in one basket. Kuti murume wako is everything. Because one day that person is not going to be there and you fall into a crisis. Where vanamai gurucha hawafarire, vamwena hawafariri, vanateta hawafariri, urukunyepa to ndiye best friend yako. I think it's not safe for anybody.
Thank you so much. And I'm now answering his first question. But allow me, ndigare past na before 4 o'clock, unfortunately. But now we're almost into 5 o'clock. So, Elder, I think that's my problem. Yeah, so, yeah, so I don't even know how much time do I don't know. But yeah, maybe next time I'll try to contain. These things, the challenge there could, depression alone, it's a 1-week seminar. I've taken the short intervention. There are a lot of material that I've left here. I'm not talking about this slide. One condition, it's a week-long seminar, unfortunately. So we are trying to compress it to 1 hour or 1 hour 30 minutes. So that's why you are seeing me trying to skip other things. Because of the papers that I have here, I'm seeing other hands. So sorry, sorry, teacher Ndichakupai. The papers that I have here, I'm seeing numbers here. And because of those numbers, I want to sing this song and pray. Ndinamatire, ndigo kunamatirawo. Ndinamatire, ndigo kunamatirawo. Ndinamatire, ndigo kunamatirawo. O seiko singa ndinamatirewo. Dzimwe nguva muchato wacho unorema. Dzimwe nguva muchato wacho unorema. Dzimwe nguva muchato wacho unotiremera. O seiko singa ndinamatirewo. Dzimweni dzenguva mhuri yangu inotiremera. Dzimwe nguva mhuri yangu inorema. Dzimwe nguva mhuri yangu inondiremera. O seiko singa ndinamatirewo. Vanoda special prayer nyika tikurama vanhu vaMwari inorema. Dai Mwari akatendera kuti tive negirazi pamoyo, hakuna waigona kugara pane umwe tichiona zviri mukati. Vanhu vakaremerwa. Sometimes we throw very dangerous comments. Nyika tikurama inoremai. But we have a faithful God who is a faithful burden bearer. No matter the burdens that we have, if we come to him, he said, come to me, ye who labor, and I will give you rest. He is the faithful burden bearer. Let's cease to be the CEOs of our lives. Let's come to him. Let's give him everything. He will solve our issues. Such who want such a prayer, can we stand? Tinamat. Ukanamata mtoro wacho unoreruka. ukanamata toro wacho unoreruka, ukanamata toro wacho unoreruka, o seiko singandi nama tirewo. As the pastor is coming to pray for us, to those who need one-on-one, for this week, I'm your servant. I'm there at your disposal. Number mnayo, just book per WhatsApp. I don't mind even to lose divine service. Let's talk about it. Because after this, if you come to my clinic, it's $50, 30 minutes.
Shall we pray? Okay, let's pray. Our dear Heavenly Father, we want to thank you so much, Lord, for the moment we had to learn, especially about depression. Depression came because of sin. Lord, we come before your throne of mercy. Your people are on their feet right now. We do not know what made them stand, but you as our God and Father, you know. You are our everlasting Father, the Prince of Peace. You are the Counselor. I pray in a very special way, Lord, that as we end this lesson, we end it, Lord, with deliverance that comes from above. I pray, Father, that you attend to each and every one of us, Lord, in a very special way, and heal us, Father, from depression. I know, dear Lord, that some of the things that we are going through, we will have to carry them up until the end. But may your grace be sufficient for us, Lord. May we never give up on you, but may we continue to follow you and to be faithful up to the end. May you bless us, Father. Some issues are social, some issues are financial, some issues are physical, some issues, Lord, are emotional, some issues, Lord, are mental. You know them, Father, and you know the best way, Lord, to help us. It is my prayer, Lord, that you help us in a very special way so that we are freed, we are set free, Lord, from anything, Father, that's bringing our souls down. May you bless us, Lord, and continue, Lord, to guide us and continue, Father, to sustain us up until one day we see you and meet you in the clouds of heaven. May you bless also your manservant for this special task that you have given him, Lord, to help all those who are burdened. Continue, Father, to show yourself in a great way as he does his work. May many people, Lord, be delivered, not by him, but by your mighty power through him. I thank you, Father, for you are faithful. You have heard and answered our prayers. In Jesus' mighty name we do pray. Amen.